Personality disorders. These behavioral patterns in personality disorders are typically associated with severe disturbances in the behavioral tendencies of an individual, usually involving several areas of the personality, and are nearly always associated with considerable personal and social disruption. Additionally, personality disorders are inflexible and pervasive across many situations, due in large part to the fact that such behavior is perceived to be appropriate by that individual. Personality disorders can lead to personal problems that induce extreme anxiety, distress, and depression. They can be divided into three main clusters. Cluster A, odd. Paranoid personality disorder is characterized by paranoia, suspiciousness, and mistrust of others. Symptoms of this disorder include excessive sensitivity to setbacks and rebuffs, tendency to bear grudges persistently, constant suspiciousness, pervasive tendency to distort experience by misconstructing actions of others as hostile, a combative and tenacious sense of personal rights, out of keeping with the actual situation, recurrent suspicions without justification regarding fidelity of partner, tendency to experience excessive self-importance, preoccupation with unsubstantiated conspiratorial explanations. Causes of this disorder include a genetical link with schizophrenia, parental modeling, projection of internal negative feelings. Treatment for this disorder. Because of reduced levels of trust, there can be challenges in treating paranoid personality disorder. However, psychotherapy, antidepressants, antipsychotics, and anti-anxiety medications can play a role when an individual is receptive to intervention. Schizoid personality disorder is characterized by a lack of interest in social relationships, a tendency towards a solitary lifestyle, secretiveness, emotional coldness, with a simultaneous, rich, elaborate, and exclusively internal fantasy world. Symptoms of this disorder include emotional coldness or detachment, a limited capacity to express either positive or negative emotions towards others, consistent preference for solitary activities, very few, if any, close friends or relationships, and a lack of desire for such, indifference to either praise or criticism, taking pleasure in few, if any, activities, indifference to social norms and conventions, preoccupation with fantasy and introspection, and a lack of desire for sexual experiences with another person. Causes for this disorder include genetically linked to schizophrenia, unloving, intrusive, or neglectful parenting is also hypothesized to play a role. Treatment for this disorder. Schizoid personality disorder can be treated with medication like the use of antipsychotics. Supportive psychotherapy is also used that focuses on areas such as coping skills, improving social skills and social interactions, communication, and self-esteem issues. Schizotypal personality disorder is characterized by a need for social isolation, anxiety in social situations, odd behavior and thinking, and often unconventional beliefs. Symptoms of this disorder: coldness and aloofness, behavior or appearance that is odd, eccentric, or peculiar, poor rapport with others and a tendency to social withdrawal, odd beliefs or magical thinking, influencing behavior inconsistent with social norms, suspiciousness or paranoid ideas, obsessive ruminations without inner resistance, often with sexual or aggressive contents, unusual perceptual experiences like illusions, vague, circumstantial, metaphorical, over-elaborate, or stereotyped thinking manifested by odd speech, occasional psychotic episodes with intense illusions, hallucinations, and delusion-like ideas, usually occurring without external provocation. Causes for this disorder: genetically linked to schizophrenia, early separation of parents, early childhood neglect or trauma. Treatment for this disorder: long-term psychotherapy focusing on improving social skills is the most effective treatment. Medication is also shown to help. However, group therapy or self-help is not effective, as individuals with this disorder tend to be mistrustful of others and anxious in social situations. Cluster B, dramatic. Antisocial personality disorder is characterized by a pervasive pattern of disregard for and violation of the rights of others that begins in childhood or early adolescence and continues into adulthood. Symptoms for this disorder: a callous unconcern for the feelings of others and lack of the capacity for empathy. Gross and persistent attitude of irresponsibility and disregard for social norms, rules, and obligations. Incapacity to maintain enduring relationships. Very low tolerance to frustration and a low threshold for discharge of aggression, including violence. Incapacity to experience guilt and to profit from experience, particularly punishment. Markedly prone to blame others or to offer plausible rationalizations for their behavior. Persistent irritability. Causes of this disorder: childhood neglect, deprivation, or abandonment. Childhood abuse, physical, emotional, or sexual. An alcoholic or antisocial parent. It is also worth noting that the majority of people with antisocial personality disorder are men. Treatment for this disorder: to date, there have been no controlled studies reported which found an effective treatment for antisocial personality disorder. This is especially bad because people with this disorder tend to pose a threat to everyone around them. Furthermore, majority of serial killers have antisocial personality disorder, further reinforcing why a lack of treatment for this disorder can be dangerous. Borderline personality disorder. It's characterized by unusual levels of instability in mood, black and white thinking, as well as chaotic and unstable interpersonal relationships, self-image, identity, and behavior. Symptoms of this disorder: frantic efforts to avoid real or imagined abandonment, a pattern of unstable and intense interpersonal relationships characterized by alternating between extremes of idealization and devaluation, identity disturbance, unstable self-image or sense of self, impulsivity in at least two areas that are potentially self-damaging, example, promiscuity, eating disorders, binge eating, substance abuse, reckless driving. Recurrent suicidal behavior, gestures, threats, or self-injuring behavior. Instability of moods, chronic feelings of emptiness, inappropriate anger or difficulty controlling anger. Causes of this disorder: genetic, child abuse. It should also be noted that this disorder is more common amongst women. Treatment for this disorder: psychotherapy is the most basic and effective treatment of borderline personality disorder. Hospitalization and medication is shown to have little to no effect, although some antipsychotic drugs may help. Histrionic personality disorder is characterized by a pattern of emotional and attention-seeking behavior, including an excessive need for approval and inappropriately seductive behavior. Symptoms of this disorder is uncomfortable in situations in which he or she is not the center of attention. Interaction with others is often characterized by inappropriate, seductive, or provocative behavior. Displays rapidly shifting and shallow expressions of emotions. Consistently uses physical appearance to draw attention to self. Has a style of speech that is excessively impressionistic and lacking in detail. Shows self-dramatization, theatricality, and exaggerated expression of emotion. Is suggestible, as in easily influenced by others or circumstances. Considers relationships to be more intimate than they actually are. Causes of this disorder: genetic, deaths or illnesses in immediate family during childhood, constantly anxious family environment during childhood, divorce of parents. It is also worth noting that this disorder is more common amongst women. Treatment for this disorder: the most effective treatment is psychotherapy or cognitive behavioral therapy, aimed at self-development through resolution of conflict. Group therapy can assist individuals with histrionic personality disorder to learn to decrease the display of excessively dramatic behaviors, but must be closely monitored because it may provide the person with an audience to perform for. Narcissistic personality disorder is characterized by an excessive preoccupation with personal adequacy, power, prestige, and vanity. Symptoms of this disorder: reacts to criticism with anger, shame, or humiliation, may take advantage of others to reach his or her own goal, and has trouble keeping healthy relationships, tends to exaggerate their own importance, achievements, and talents, imagines unrealistic fantasies of success, beauty, power, intelligence, or romance, requires constant attention and positive reinforcement from others, is easily hurt, rejected, or jealous, lacks empathy, disregards the feelings of others, and appears to be unemotional, obsessed with oneself, mainly pursues unrealistic and selfish goals. Causes of this disorder: an oversensitive temperament at birth, being praised for perceived exceptional looks or abilities by adults, excessive admiration that is never balanced with realistic feedback, excessive praise for good behavior or excessive criticism for poor behavior in childhood, overindulgence and overvaluation by parents, severe emotional abuse in childhood. Treatment for this disorder: the most effective treatment is schema therapy, a form of therapy that integrates psychodynamic, cognitive, and behavioral therapy. However, it is highly unusual for people to seek therapy for narcissistic personality disorder. Cluster C, anxious. Avoidant personality disorder is characterized by a pattern of social inhibition, feelings of inadequacy, extreme sensitivity to negative evaluation, and avoidance of social interaction. Symptoms of this disorder: hypersensitivity to rejection and criticism, self-imposed social isolation and mistrust of others, extreme shyness or anxiety in social situations, though the person feels a strong desire for close relationships, emotional distancing related to intimacy, avoids physical contact, feelings of inadequacy, inferiority, low self-esteem, and self-loathing, highly self-conscious, self-critical about their problems relating to others, lonely self-perception, although others may find the relationship with them meaningful, utilizes fantasy as a form of escapism and to interrupt painful thoughts. Causes for this disorder: genetic, childhood emotional neglect, peer group rejection. Treatment for this disorder: effective treatments include social skills training, cognitive therapy, exposure treatment to gradually increase social contact, group therapy for practicing social skills, and sometimes drug therapy. Unfortunately, individuals with avoidant personality disorder are likely to never overcome the disorder because of the deep-seated feelings of inferiority and extreme social fear, and are also likely to drop out of treatment if they feel too anxious. Dependent personality disorder is characterized by pervasive psychological dependence on other people. Symptoms of this disorder: encouraging or allowing others to make most of one's important life decisions, subordination of one's own needs to those of others on whom one is dependent, and undue compliance with their wishes, unwillingness to make even reasonable demands on the people one depends on, feeling uncomfortable or helpless when alone because of exaggerated fears of inability to take care for oneself, preoccupation with fears of being abandoned by a person with whom one has a close relationship and of being left to care for oneself, limited capacity to make everyday decisions without an excessive amount of advice and reassurance from others. Causes of this disorder: insecure attachment to others, clinging parental behavior. It is also worth noting that this disorder is more common amongst women. Treatment for this disorder: group psychotherapy is the most effective treatment for this disorder. Medication and hospitalization is shown to have little to no effect. Obsessive-compulsive personality disorder is characterized by a pervasive pattern of preoccupation with orderliness, perfectionism, and mental and interpersonal control at the expense of flexibility, openness, and efficiency. Symptoms of this disorder: feelings of excessive doubt and caution, preoccupation with details, rules, lists, order, organization, or schedule, perfectionism that interferes with task completion, excessive conscientiousness, scrupulousness, and undue preoccupation with productivity to the exclusion of pleasure and interpersonal relationships, excessive pedantry and adherence to social conventions, rigidity and stubbornness, unreasonable insistence by the individual that others submit exactly to his or her way of doing things, or unreasonable reluctance to allow others to do things, intrusion of insistent and unwelcome thoughts or impulses. Causes of this disorder: genetic, childhood psychological trauma. It is also worth noting that this disorder is more common amongst men. Treatment for this disorder: psychotherapy and self-help are the most effective forms of treatment. Anti-anxiety medication may reduce feelings of fear, while antidepressants can ease frustration and reduce stubbornness. However, in some cases, the patient does not accept that they have obsessive-compulsive personality disorder and believes that their thoughts and behaviors are in some sense correct and therefore should not be changed. From this documentary, it can be concluded that one's personality affects a vast number of areas, from relationships to careers to health. Thank you for watching.